The utility of neutrophil CD64 and perception as diagnostic, prognostic, and monitoring biomarkers in neonatal sepsis. My name is Heba Izzat Hashim, clinical pathology lecturer in Shams University Hospitals, Egypt. Regarding the disclosure, I have nothing to disclose. Our objectives today is including introduction about neonatal sepsis, aim of the study, methodology, results, discussion, and finally conclusion and recommendation. I will begin my presentation by some questions. The first one is why neonatal sepsis? Why we are discussing neonatal sepsis? Because actually neonatal sepsis is associated with high mortality and high morbidity among the survivors. And this slide demonstrates the different causes of deaths among the neonates and neonatal sepsis and the infectious complication present on the top of the list, which may be higher even in the developing countries. And this slide demonstrates the high morbidity among the survivors, not just the mortality, but also the neurodevelopmental disabilities with the deafness, blindness, and the renal impairment with the motor disabilities among our children. So early diagnosis, follow-up, and the proper treatment not only increase the survival rate, but also improve the prognosis among the survivors. Neonatal sepsis passing through different stages, beginning from serous systemic inflammatory response syndrome, passing into sepsis, severe sepsis, and septic shock. And these stages can occur very rapidly within hours or days, so early diagnosis is very important and critical. Second question is why biomarkers? Why we are studying biomarkers? Because actually the conventional laboratory methods, including the blood culture techniques, hematological indices, and CRP, are suffering from some limitations and many diagnostic obstacles, including the time needed to release the result of the blood culture, which may need days to release the result, low sensitivity of the hematological indices, and the impossibility of excluding the contamination in some circumstances. So biomarkers are very important for and valuable for the diagnosis of neonatal sepsis. The third question is why we are studying these sepsis biomarkers, specifically CD64 and perception in our study, because actually many publications are published last year regarding the promising role of either neutrophil CD64 or perception in neonatal sepsis. Additionally, we have the devices for either of these tests that can be applied as a routine test in our neonatal ICUs in our hospitals. Regarding the diagnosis of neonatal sepsis, it includes a combination of both the clinical judgment and the clinical score in addition to the laboratory and radiological finding. And regarding the laboratory diagnosis, the new trend nowadays in the different neonatal ICUs, including the combination of conventional methods, including CRP, hematological indices, and blood culture, in addition to new biomarkers, including the molecular techniques, cell surface markers like CD64, CD11B, CD14, or perception or procalcitonin for rapid and accurate diagnosis. The challenge of biomarker identification is reflected by the fact that over than 3,000 sepsis biomarkers studied last year to reach the best diagnostic biomarker. Neutrophil CD64 as a sepsis biomarker is a cell surface marker present on the surface of neutrophil. It is upgraded and increased in its percent in the presence of the infection. Perception is another sepsis biomarker. It is a breakdown product of soluble CD14, which is formed by shedding of CD14 from the cell membrane into the circulation. We studied CD64 in first study we did, and it was published in the 2020. We compare its result comparable to the highly sensitive CRP, and actually it showed and achieved good and promising results. So we recommend after this study to be applied routinely in our neonatal ICUs. And the second study, which is my concern here in this presentation, was to compare the utility of neutrophil CD64 comparable to the Perceptin to know which is better than the other as a diagnostic, prognostic, and monitoring biomarkers in neonatal sepsis. So the aim of our study was to evaluate the diagnostic, prognostic, and monitoring performance of both neutrophil CD64 and Perceptin as sepsis biomarkers comparable to each other and comparable to the conventional laboratory sepsis biomarkers, aiming to decide which is the best fitting for routine daily use in neonatal ICUs. Our aim was to answer the following question sequentially. The first question was, what about the diagnostic performance of each of these sepsis biomarkers? The second question, what about the comparison between them? The third, which panel of markers achieve the best diagnostic performance? And the fourth, what about the monitoring power of neutrophil CD64 and Perceptin in neonatal sepsis? And finally, what about the prognostic performance of any of them? Patients and methods. Our patients were 235 neonates were enrolled from 3 Egyptian neonatal ICUs, and they were classified into 2 main groups, the control group and the sepsis group. Control group included 102 patients, and the sepsis group including 133 patients. Sepsis patients were selected according to the guideline definition of the sepsis stated here. And the patients were classified into 5 groups. The first group, healthy control group, and the second, the pathological control group, and 3 sepsis group, including clinically suspected sepsis with the blood culture negative sepsis, and the second group, the blood culture proven sepsis, and finally, severe sepsis and septic shock group to test the diagnostic performance and the efficacy of the studied sepsis biomarkers. Neonates were subjected for the following: the blood culture as a standard for sepsis diagnosis, CBC, CRP evaluation, flow cytometric analysis of CD64, and finally Perceptin. The CD64 was measured by the flow cytometric assay, and it was expressed as CD64% and CD64 MFI, mean fluorescence intensity. Perceptin was measured by the bath-fast test, and it was measured by the chemiluminescent assay as a point-of-care testing. Regarding the results, there were a significant increase in CD64 and Perceptin value in the sepsis control groups comparable to the controls, while CD64 at cutoff value for 41.6% achieved the highest sensitivity, while Perceptin at the cutoff 686 picogram per ml achieved the good sensitivity also, but higher specificity than CD64. So the comparative statistical analysis was done between either of these sepsis biomarkers comparable to the conventional laboratory markers. Hematological indices include absolute lymphocytic count, absolute neutrophil count, and the total leukocytic count, the hemoglobin value, the platelet, and the CRP. And the comparison was done between the healthy controls versus sepsis patient in one side, and between the diseased control versus the sepsis patient. And there were significant values regarding these biomarkers, including the blood platelet count, CRP, CD64, either CD64% or MFI, and the Perceptin. This for both the controls versus the sepsis patient. Again, box plot was done, and it showed that CD64% and Perceptin showing significant values difference between the sepsis group comparable to either healthy control or disease control. Regarding the diagnostic efficacy and the sensitivity and the specificity of these sepsis biomarkers, the best result was achieved by the combination of Perceptin and CD64 measurement. However, if this combination is not available in the healthcare facility due to the financial consideration, so the second good combination is the CD64 and CRP. The third one was the Perceptin and CRP. While the highest efficacy for the univariate test was achieved by the neutrophil CD64%, followed by Perceptin, followed by highly sensitive CRP. This is a ROC curve analysis, and the area under the curve, the best one was achieved by neutrophil CD64, followed by Perceptin, followed by CRP. Again, the multi-regression analysis was done and the multiple models was performed. The final model achieving the highest F ratio was achieved by the combination of measurement of both CD64 and percent. and perception. The fourth question was, what about the monitoring power of neutrophil CD64 and perception in neonatal sepsis? Which of these biomarkers can be used for monitoring our patient in the neonatal ICUs? So we make a follow-up evaluation for our patient after 5 days from the first evaluation, and the delta change between the first initial evaluation and the follow-up evaluation was performed, and the delta change value, the highest value, was achieved by CD64%, followed by perception, followed by platelet and CRP. And the final question in my presentation about the prognostic performance of this biomarker, which of these biomarker can predict and can be used as a predictor for the prognosis of sepsis patient from the start? And it shows that neutrophil CD64 MFI percent and the highly sensitive CRP and the platelet showing a significant differences between severe sepsis and non-severe sepsis patient, while comparing severe sepsis with non-severe sepsis patient regarding perception failed to achieve the significant value in such concerned issue. So the conclusion of my study, I will conclude that neutrophil CD64 and the perception biomarkers are significantly higher among sepsis patients compared to the control, suggesting their potential role for early diagnosis in neonatal ICUs. The highest sensitivity could be achieved by a univariate sepsis marker is recorded by CD64, while the highest specificity documented by perception. CRP achieved a remarkable specificity, but actually associated with undesirable sensitivity, make it less ideal in early sepsis diagnosis. The best diagnostic efficacy for early sepsis diagnosis can be reached by the combined measurement of both CD64 and percent. However, if this combination is not available in the healthcare facility, so either of neutrophil CD64 or perception can be measured individually, while the combined measurement of neutrophil CD64 or perception with highly sensitive CRP gives a better diagnostic validity than any of them alone. Both neutrophil CD64 and perception are valuable markers for monitoring purposes of neonatal septicemia. One should interpret the result in context with the patient's clinical condition for the best clinical judgment. And finally, neutrophil CD64 carries a promising role over perception in reflecting sepsis severity. And so I reached to the final part of my presentation. I put this slide to demonstrate that for any of these sepsis biomarker, the result should be interpreted in combination with the other laboratory results, with the radiological finding, and with in context with the patient clinical condition for the best clinical judgment. I put this photo for one of our children in our hospital suffering from neonatal sepsis in his neonatal period. So the diagnosis of this disease very early is very important and very critical. And this photo for our neonatal ICUs in Shams University hospitals. This is my references, and I had finished my presentation. Thank you for your attendance, and thank you for your listening.